Access to healthcare is extremely important right now, and there is a lack of that is coming into our communities. So mobile integrated health is a really unique opportunity to really provide innovative healthcare solutions to communities and help bridge the gaps and fill in gaps that are currently in the system today by using community paramedics and also paramedics within street operations.
Every corner of the country and any corner of the world has different needs and different types of resources and access to care, and there's no cookie cutter approach to those. So I think having a characteristic and a principle of being adaptive and being able to pivot to adjust to those needs is vitally important in designing an MIH program. A very large portion of the population not having a primary care provider. And us working with our system partners to design models that are flexible, are mobile in the communities, especially in the rural settings where, there's nothing. Us bringing care to that area of need is huge. It's taking a step back and understanding those needs, but also being very mindful that something's not working. If data is telling us that,
data dictates change. And then so really to implement or to expand any programs, we need the data to prove that.
Data can be used in a lot of different ways, especially when we're trying to identify any gaps in the system or any trends in the system that might need a result of a new solution. So taking that and comparing it to other partners' data that might tell the same story or it might deny what we're thinking, and then just starting to formulate those ideas and solutions around what the data is telling us. So that could be the types of conditions that are becoming very prevalent in the community, the number of cases that are being brought to an emergency department that necessarily could be served better elsewhere, and trying to figure out how can we solve that problem and mitigate any issues that are arising in the system. The other more important piece around data is not just numbers and figures. It's getting feedback from our staff and assessing their satisfaction by being part of the team, by being part of the solution.
First thing would be take your time in developing and having conversations with partners in your community so that everyone understands where you're coming from. We do not replace existing services, and that's always a fear that communities have, is that paramedicine is now coming in to replace other existing current services, and that's not what we do. We come in to help fill gaps. So having that communication is really important. And I think just being flexible with the programming, knowing that what you initially start off with is not going to 100% work, and really just being flexible and working with your partners and the clients and the community. When a client can come up to you to say, because of you, I'm alive today, and the help that you provided when I was addicted and I am not anymore has really been a proud moment in my career.
That's why we all became paramedics and became part of, the pre-hospital care world.
Every day we have the ability to impact someone's life, and you have the opportunity to do that individually or collectively.